Welcome to Counterpoint. I'm Tanya Allen. Do you remember back in March of 2020 feeling like the world was going to end? We were told by modeling experts that unless countries adopted strict lockdown measures, the number of fatalities from COVID-19 would be catastrophic, with 2.2 million deaths in the US alone, for example. Well, thanks to the modeling system developed by Neil Ferguson at Imperial College, several countries, including Canada, instituted nationwide lockdown measures to help mitigate these horrific projections. But just how accurate was Imperial College's modeling? For example, Sweden, they ignored their advice completely and proved the modeling system wrong by over 390%. And serious questions are now being raised as to whether such extreme lockdown measures were ever warranted in the first place. Well, joining me now to unpack the data and analyze the Imperial College's modeling is Philip W. Magnus, a senior research fellow at the American Institute for Economic Research. Mr. Magnus, welcome to the show. How are you doing today?
Oh, doing outstanding. Thanks for having me.
Okay, I'm really excited to dive into this topic because I think this has been, I would say top of mind, but certainly since the beginning of the COVID crisis, folks were expecting to see this big surge in deaths globally. And frankly, I don't know if there's a corner in the world where we have seen that. So I'm excited to kind of delve right into these numbers. So let's start with the beginning. So the first projections that came out were from a gentleman named Neil Ferguson, who is a physicist, and he was responsible for the Imperial College modeling out of the UK. Why did the world look to him for this modeling, and why was he so influential with respect to projecting these figures?
Yeah. So Neil Ferguson, as you mentioned, he's this physicist that was one of the pioneers in epidemiology of applying computer models. He started back in the late 1990s and early 2000s of taking almost like SimCity style computer games and adapting them to study the transmission of viruses and epidemics. And as a result of this, he had some stature in the field. And when COVID-19 hit and the world was kind of in a panic about this novel, uncertain virus, he was one of the people that was out front and center offering answers. And those answers tended to project very alarmist, over-the-top death tolls that would be coming if we didn't do anything to mitigate the pandemic.
And so he was very influential globally, as we mentioned, and he was definitely pushing for global lockdowns, that every country needed to lock down. We need to mitigate what he felt would be this surge of not just cases, but death.
Absolutely. So Ferguson burst onto the scene around mid-March of 2020. And you remember there was a day that both Boris Johnson, the UK Prime Minister, and then President Trump had press conferences where they announced that we needed to enact all these emergency measures,
Right,
including shifting toward lockdowns. And he was on the actually at the press conference with Boris Johnson. They projected 500,000 deaths in the UK and 2.2 million deaths in the United States. But the other thing that Ferguson did is he continued to write his models. And about 2 weeks later, they released another paper that had about 190 different countries where they announced their coronavirus death projections. And that included everything from Canada, Australia, most of Europe, to parts of Africa, parts of Asia. You had projections for everything. And every single one of them was similar alarmism, and not a single one of them to date after the 1-year anniversary has come true.
Okay, well, let's talk about his projections. So in general, how accurate were they?
Well, the worst case scenario that he projected, the furthest that he was off, was by 1.7 million% in Taiwan.
Wow.
We know Taiwan is distinctive for its response to the pandemic because they did not adopt lockdowns. They had some minor measures internally to inform people that, wash your hands and take steps to avoid the virus. And they did shut off their borders to international travel. But internally, Taiwan never locked down. According to Ferguson's model, this was supposed to result in deaths in the hundreds of thousands in Taiwan. As of the 1-year anniversary, I think they had 12 deaths total.
My goodness.
So that's how far off he was.
12 deaths total. That's amazing. And good for them. And I do recall that yes, you're right. They were one of the earlier countries. In fact, they were the first country, I believe, that shut its international flights to China. They obviously have a long history with China, and for whatever reason, they did that, and America followed soon, I'd say about 3.5 weeks after. Canada, I don't believe we ever did shut our borders. We have about 20 seconds before we get to the commercial, but I wanted to kind of tease as to some of the other countries we might want to explore. And maybe we'll start with that as we head into this commercial. But, we will talk about Sweden. Everybody looks towards Sweden. They implemented such lax measures. Did we see the surge in deaths in Sweden? Well, we're going to explore that right when we return from this commercial break. Stick around, please. Welcome back. We're discussing the COVID death modeling, and we're doing that here with Philip W. Magnus, Senior Research Fellow for the American Institute for Economic Research. Philip, you've come out with some of your own criticisms of Neil Ferguson out of the UK, his modeling and his projection as to what would happen. Let's just extrapolate this to let's take a bird's eye view to Europe, for example. Ferguson claimed, and correct me if I'm wrong, that there would be such catastrophic death even within Europe. And he said that because of the modeling and the recommendations, over 3 million lives were saved. Is this accurate in your opinion?
So this is a scientific absurdity. Basically, what he did is he took his overarching alarmist projections from his own models and subtracted the difference between the number of deaths that actually occurred, and then claimed that he was to credit for the difference between what his model projected and what really happened. Of course, no scientist that's worth anything in the world would look at that and consider it a valid scientific or social scientific research technique. This is not vetting anything into his models. It's rather just asserting that his models kind of prove themselves. So there's no real test.
Well, some people might argue, though, and not everybody's a physicist or does epidemiological modeling. However, some people would suggest, well, because say in Canada we did do such a strict lockdown, as we did in certain parts of the world as well, and we have continued to isolate. Some people might say, well, because we had limited interaction, that of course those numbers did come down. You suggest no scientist worth their salt that would carry any weight, but to me as a laywoman looking in, I might say, well, that sort of seems to add up.
Well, as scientists and social scientists, we have to look for counterfactuals. We have to look for other examples that did not lock down to see if they followed the course of what Ferguson and his fellow modelers projected in the pandemic. And this is not just me speaking. This was actually highlighted in a 2019 report from the World Health Organization. It said that we cannot rely on models alone. We need actual testing and testing against counterfactuals. So that's where the interesting cases come up. Places like Taiwan and Sweden and Japan and South Korea, these are countries that either did not lock down at all or locked down very lightly, had maybe a couple localized measures, but nothing near what we saw in the United States or Canada or most of Europe. So those are the counterfactuals we can look to, and we can actually see how the models performed in the absence of lockdowns in those countries. And in every single one of them, Ferguson's model is catastrophically off. It's alarmist, it's exaggerated, and we're talking by minimum of 100% off, sometimes in the tens of thousands, or in Taiwan's case, millions of percentage points off.
So let's look to Sweden then. You mentioned Europe. We were talking about Europe. Why is Sweden so important in refuting Ferguson's modeling claims?
So Sweden bucked the trend of the entire European continent, and it's a developed economy, so it's very similar to most other countries in Northern Europe, but they said no to lockdowns. And they did so in the face of the model. So back in April of 2020, there was a team of researchers at Uppsala University in Sweden, and they adapted Ferguson's model to their country. And they said, well, if we don't lock down by next week, there are going to be 90,000 people dead by the time the summer hits. It turns out it's only like 3,000 or 4,000. And as of the 1 year mark, I think Sweden is at 14,000. They got hit with a really hard pandemic per capita, but it's no different than other countries in Europe that did enact these very serious and severe lockdowns and basically got the same results as Sweden, or in some cases even worse than Sweden.
And you're an American. We here in Canada often we look to see our Toronto Blue Jays playing, the Texas baseball team, and seeing everybody unmasked in a stadium. We said, what on earth is that? That seems so foreign to us. So it seems so out of reach. But there's an example of Texas, where they have now lifted all restrictions, or you can even look to Florida, where they implemented very few, in my opinion, or very few strict measures. Were their case counts different than, say, a state, for example, like California, which not only had a mask mandate inside, but they also had one, I believe, outside?
Right. We can look to the stats from California and New York. These are both large high population states. New York's almost about the same size as Florida. California is a little bit bigger than Texas, but you had two states that locked down heavily, New York and California, and two states that did not, Texas and Florida. And those are the ones that reopened. And the case numbers, the death numbers, all of the statistics are basically the same. Or in some cases, New York ended up doing a little bit worse than other similarly sized states that did not lock down. So again, we have the counterfactuals of places that bucked the policy advice, and they're basically proving that that policy didn't really accomplish anything other than severe economic harm, severe restrictions on the population, severe restrictions on the freedom of the people that live there.
And in Canada, we've seen such extreme mental health toll from these kinds of lockdowns. We're still in one, and we still have a stay-at-home order more or less in place here, where I am in Ontario, and many parts of the country seems to be in that situation. Well, we're going to pick up this discussion right when we return from this commercial break. Please stick around. Welcome back. We're continuing our discussion on the modeling COVID death projections by Neil Ferguson out of the UK. And joining me to kind of dissect his work is Philip Magnus, Senior Research Fellow at the American Institute for Economic Research. Philip, we were talking about Sweden before the break and how they kind of bucked the trend of Europe by not enforcing these strict measures, and also bucking the trend in terms of they didn't have a high infection rate, they didn't have a high death rate. But Neil Ferguson himself has claimed that the data coming out of Sweden was not based on his modeling, and it was conflated with other models. How would you respond to his counterclaim?
Well, Neil Ferguson is engaged in some very serious deception there. This comes back to a testimony he gave before the House of Lords in the UK last summer, where he denied he had anything to do with the Swedish projections that claimed 90,000 people would die if they didn't lock down. Well, it turns out if you go back to his own released models and papers, they had data files from back in March of last year where they did in fact project Sweden. They did in fact project every other country in Europe. And it turns out that Sweden was anticipated to have similar catastrophic death tolls that never happened. So he was in the neighborhood of just short of 90,000 deaths projected for Sweden. It ended up 1 year later at about 14,000. And this is true of every single country on earth. So Neil Ferguson really kind of engaged in some PR to cover up his tracks, to hide the fact that he had made these outrageously wrong projections for every other country on earth when they started to falter in places like Sweden.
Certainly. You was speaking about these forecasting. So you've stated obviously, and you've just explicitly said that here, that Ferguson and the Imperial colleges, that they had exaggerated forecasts, that they may well constitute one of the greatest scientific failures in modern human history. Could you expand on that for us, please?
Absolutely. This was a team of researchers that presented themselves as experts that were going to guide the world through the coronavirus pandemic. If you read the reports, they are saying every country in the world should adopt these non-pharmaceutical interventions, lockdown, social distancing, all of the measures that we've come to become familiar with over the last year. And yet it turns out that the measures made very little difference. Not only that, the projections that were made were built around a model, and this is really pertinent to the failures in Canada of their model. They were built around a model that neglected one of the greatest vulnerabilities in society, and that is nursing homes.
Right.
They actually stated in one of the papers that nursing homes are not included in their model, and it turns out that nursing homes are the one place where deaths have basically run rampant. The latest stats in Canada, I believe 69% of about 24,000 people that have died of coronavirus in Canada were in nursing homes. And that includes, I've had family members in Toronto that passed away in a nursing home. So it's disastrous in the sense that they alarmed the world, but they diverted our attention from the one area that we could have stepped in and actually done something that mattered, done something that would have saved lives.
Oh, I agree. And the reports are coming out. And first of all, my condolences to you and your family on the loss of your family member. I'm sorry to hear that. But you're right. That was ground zero for COVID in Canada, is really the LTCs. And thank you for refreshing the statistic. I know early on it was about 80% of all deaths were in LTCs, so now it's been reduced to 69%. So that's good information to know. But clearly the bulk of COVID deaths were in LTCs. And we've had other experts on, emergency preparedness experts, that said, really that is where we needed to focus our effort, not on the population that would be less affected by an infection of corona or not get infected at all. So that's very interesting. I guess just delving more into the Canadian situation. So just so that we're clear for our viewers, so Canada based its projections also on Neil Ferguson's model. Is that correct?
Right, that is correct. And he was anticipating over 250,000 deaths in his most extreme scenario. The unmitigated or do nothing scenario had 266,000 deaths were projected in Canada. And then he said his more conservative scenarios, he says if you enact lockdowns, including really strict lockdowns, maybe if you're lucky, your best case will be 45,000 deaths. So his best case scenario was twice as bad as what we actually had.
Right, I was going to say we're about half that amount thus far. And obviously, I don't think anybody anticipated this going on for well over a year. We're past the 1 year mark. We're at 15 months already. Again, this is very interesting because I think Canadians need to know who's making these decisions and on what data. You know, we keep hearing there's a science table, trust the science, trust the experts, trust the authorities, but where are they getting their information? Is it the World Health Organization? Well, based on what you're explaining, that a lot of the, perhaps early on, reasonable alarmism and now perhaps not so reasonable alarmism was due to this modeling. And if you kind of step back and think, wow, globally there is this large lockdown reaction based on modeling, which, as you said, could be one of the greatest scientific failures in modern history. It's just shocking to hear that. I'm stunned just sitting here. But anyways, we're going to continue and wrap up our discussion right when we return from this commercial break. Please stick around. Welcome back. We're wrapping up our discussion on the seemingly flawed COVID modeling. Philip Magness, Senior Research Fellow, American Institute for Economic Research, joins us. You've done such an excellent job of explaining why globally we relied on this data. So I guess the million-dollar question was, and you've sort of alluded to it already, is do you think a global lockdown was warranted?
Absolutely not. And I think it's been one of the greatest policy and scientific catastrophes of recent human history. We looked at all the promised benefits that the lockdown was supposed to deliver, and number one, it did not deliver. But we also know the harms that were associated with it, and this ranges from everything from economic contraction and unemployment. It's spiked a massive surge in substance abuse, in depression, in deferred treatments for other diseases, cancer screenings, things that are going to be with us for years, if not decades to come. It's basically deferred an entire generation of students from a year or more of schooling in person in some cases. This is something that's going to be with them for the rest of their lives. And if you want to do a true cost-benefit analysis of a policy, and we ask what happened with the lockdown, well, A, the lockdowns did not deliver what they promised in terms of mitigating the pandemic, and B, they brought all of these other harms that were not considered and not brought into the equation when we decided to follow this route.
Well, maybe you should do a full-on CBA cost-benefit analysis on this once we are done, hopefully soon, at least in Canada. I think you're sort of seeing the tail end of your lockdowns in America with your recent announcement that there needs to be no longer masking outside, which is great, and indoors to some degree. Okay, great. I hear what you're saying, that people, obviously, hindsight, we see that the lockdowns didn't work, but some people might say that. They'll say, well, Mr. Ferguson, it's easy to apply hindsight being 2020 now. It's easy to look through that lens, but perhaps he was just really seeing something that we all didn't, and we didn't work with his statistics at the time, and now we're holding to account by a different standard. Is that fair?
So I think the problem that we have here is, early on in the pandemic, we did not have good data. The earliest case numbers we had were coming out of China. We didn't know if they were reliable because a lot of them are filtered by the Chinese government.
The communists,
It's
yes.
also a novel virus we didn't have good data on. But that data rapidly updated. It rapidly expanded. As early as April 2020, we knew that the nursing homes were the vulnerability, not the general population. And yet we didn't change course. We didn't adjust our policy. We didn't fix our models to overcome this oversight, this deficiency that wasn't included in them. It was just like staying the course with an original error. And for reasons that have been catastrophic, we've retained that error for the last year.
So will Mr. Ferguson be held to account? Because obviously this has global effect. This is not just isolated to just the UK. I mean, coast to coast to coast in this country, in the globe, we've all been impacted by these lockdowns. So will the Imperial College be held to account for their failures?
So sadly, it does not appear to be the case. As of last week, Neil Ferguson is still advising the government of the United Kingdom. He still sits on the committees that are offering models to guide their own pandemic response. Unfortunately, we also look into some of the history of his own involvement in modeling and some other modelers going back to previous diseases like the avian
Mhm.
flu, the swine flu, mad cow disease. And lo and behold, if you look at their projections from the last 2 decades, they were wrong on every single one of those pandemics. They were projecting tens of thousands or millions of deaths that never occurred. And it doesn't seem like anyone in the scientific literature recognized that and said, well, maybe this guy has a history of biasing his models upwards, or maybe we need to revisit the concept of modeling. And it turns out that the people that are more conservative in their models are never rewarded. It's always the alarmist ones
Mm.
that are given the front page of the New York Times or brought in on national media to speak before the press because that gets the headlines. The people that caution alarm, the people that attempt to go in there and say, maybe let's step back and look at the data and get some better numbers. That doesn't generate headlines, so it's never the front of the discussion.
Well, you're right. Fear sells. What can we say? Fear sells
Exactly.
papers, and it compels people to act. And as you can see with many elections globally, crises definitely rewarded the incumbent. Well, we've run out of time, but thank you so much, Philip, for your insights today. It's been a very good discussion.
Thank you for having me.
Well, that was a fascinating discussion. I, for one, had heard of Neil Ferguson and the Imperial College's modeling, but that was very early on in the pandemic, and I wasn't aware that this is still driving a lot of the lockdowns that we see going on globally. And yes, these lockdowns have had repercussions. So what do we do here in Canada? We're still very much locked down in many parts of the country. Will we get out of this? And I think the burning question is, how do we make sure that we don't trust flawed modeling so that this doesn't happen again? For Counterpoint, I'm Tanya Granick-Allen.